So now we'll go to Jonathan King. Jonathan, we look forward to hearing about funding healthcare, not warfare, and vaccines, not submarines.
Thank you, Rosemary. Let me see if I can get my slide share screen.
I'll just say one more thing. If people have questions after Jonathan's talk, we'll have time for some questions. Please put them in the chat.
Okay, how do I, US screen sharing. Okay. Hi, everybody. That was thanks to Subrata and for that Pentagon budget, and do go to his talk, which has a lot of good data, and Erica has been a great source. So, you know, this dreadful coronavirus outbreak, it's not the first crisis to impact a large swath of the nation's population. The 1918 flu epidemic, the Great Depression, World War II, the HIV epidemic did so previously. In addition, our population continues to be afflicted by many forms of cancer, heart disease, stroke, arthritis, antibiotic-resistant infections, bacterial neurodegenerative diseases, notably Alzheimer's. And the major contribution, federal contribution to those programs, as Subrata mentioned, the overall federal budget has these big chunks of public money, Social Security on the one hand, and Medicare and health. But these are not paid by our income taxes. These are trust funds, right? You pay in through your lifetime and then you get the money back. But the programs, and they're inadequate, right? We know they're inadequate, millions without health insurance. Bernie Sanders' campaign, you know, I brought that to the fore, and in the next years, we're going to see this continuous struggle to get more extensive healthcare coverage, health insurance. But hidden behind that inadequacy is the shortfall. That shortfall is that these programs have very little to do with the prevention of disease, with the development of therapies, or development of vaccines. The core responsibility for improved prevention, diagnosis, treatment, and therapies falls to programs funded by the National Institutes of Health, the National Science Foundation, and to a lesser extent, the Department of Energy, because of their role in computer science. And these are carried out in colleges and universities across the nation. Catherine Royer in the Fund Healthcare Not Warfare breakout will talk in more detail about these programs. Now, within the scientific community, we know that if you want to solve a problem, you got to invest in the effort to solve them. We can make a long list of successes from federal investment, the interstate highway system, orbiting satellites, providing GPS, landing on the moon, solving the molecular structures of DNA, RNA, protein, and entire viruses, sequencing the human genome, developing HIV therapies. In contrast, the failure to invest it kind of ensures failure to solve the problem. For example, once it became clear that the SARS epidemic, the coronavirus 1 SARS epidemic was under control in 2003, the nation failed to invest the sums needed to develop a SARS vaccine. Had that been done, we would currently have been much better prepared to counter the current SARS strain, a cousin of the first one. So here's the discretionary budget, this typical of the last half a dozen years. And as Subrata made clear, more than half of the tax dollars that you send to the United States government is spent on the Pentagon and military. And in fact, most people don't even realize that the Veterans Administration, which is taking care of our soldiers, sailors, and airmen who were damaged in wars, that's not even in the military budget. That's on the civilian side. Now, the NIH and NSF budgets, which are key to prevention of disease, those are so small, they're not even in this graph. They're buried in some of these small slices. But here's a version prepared by the National Priorities Project where they actually broke out the NIH funding for that year, which was 34 billion, 3%, the NSF 0.6%, a pittance compared to the military budget. Is it any wonder that given that imbalance, we're not prepared for the current pandemic, and we won't be prepared for the next pandemic either. Now, it is true that in response to the pandemic and the death of hundreds of thousands of Americans and illness of millions, devastation to the economy, the Congress did pass the CARES Act. And the CARES Act directed about $1 billion to the NIH, 4.5 billion to the Centers for Disease Control, 3.5 billion to BARDA, the Biomedical Advanced Research Project Agency, which was something. The Project Warp Speed, that's a giant subsidy for biopharma corporations. It's right and proper to spend it to get those vaccines out, but it is not increased investment in the nation's biomedical or public health infrastructure. Just make sure that they don't lose money in the process. And these investments, a month later, the Congress still voted in the midst of the pandemic to spend $700 billion on defense. And as Erica said, all the efforts to cut it back were defeated. So the situation doesn't look good. Now, some people will tell us that, oh, those are separate pots of money. You can't move money from the Pentagon budget to the NIH or vice versa. No, not true. Here's a direct quote from Mick Mulvaney when he was the budget director speaking with the Republican Governors Association. By virtue of defending such extensive cuts, this was in the NIH, NSF, Meals on Wheels, Mr. Mulvaney said simply that the White House priority was military spending and other reductions were necessary to advance that goal. So they cut all the civilian programs 10% and moved that money onto the military side. They can't do that with Social Security, but they can do it with NIH, NSF, DOE, etc. Now, I think it's instructive our previous speakers mentioned the Ohio nuclear submarines. You know, just one of them launching all its missiles can wipe out all the cities, major cities of any country on earth, China, India, Soviet Union. The Congress now planning in this modernization program to buy 12 new ones, right? Or 9 new ones. If they just cut that down, there's 9 billion each, right? If they just cut that from 12 new subs to 7 new subs, the budget of the National Institutes could be doubled, right? A really significant increase. Now, just to make this clear for a larger group of us, Alzheimer's. 5 million Americans currently suffer from Alzheimer's. We all know somebody, a family, a parent, a grandparent, and that's a terrible disease because you stay alive, but you're not in control of yourself. Enormous need for caregivers. Costs the Medicare budget $260 billion a year, which is about 20% of the whole budget. The NIH spent, now, the best healthcare in the world doesn't help you if you have Alzheimer's. The only hope is learning more about the cause of the disease and developing preventive strategies or therapeutic interventions or drugs that slow it down, right? We made great progress on it. This is ripe for real progress, but these trials are enormously expensive. They have to be done with people and they have to have this cognitive component. This is not cheap research. The NIH budget is about $1 billion of it is dedicated to Alzheimer's. throwing $1 billion at something that's costing $260 billion a year to the economy, forgetting the human suffering, is totally inadequate. What you really need is something like, $25 billion a year to really respond to the threat as it is. Now, I wanted, Subrata made this clear, most of the money in that Pentagon budget, more than half of it, goes to a small number of very large corporations who make super profits on it. And we've heard control the government and local newspapers. I can tell you, someone who lives in Massachusetts where Raytheon is, newspaper editors know that if they get too out front about talking about the dangers of nuclear weapons or about the Raytheon sending these missiles to the Saudis, they're going to hear from it, right? Raytheon mobilizes its blue-collar workforce, its white-collar workforce. They have enormous sums of cash, and they're able to influence local politics very effectively. A state representative starts talking about peace. The Raytheon group immediately looks for a right-wing candidate to run against them as a hawk. And by the way, I hope we'll hear more about this from Larry Cohen. Yes, we have to go meet with our congressmen, but our voices compared to the military-industrial conferences with their bags of cash are very limited. We have to start looking for candidates who run on a platform of cutting nuclear weapons and run in primaries against incumbents, which is, after all, their base of power is being elected. That's the thing that will kind of scare them. Now, we do have, Erica mentioned that the nuclear disarmament movement is much smaller than the military-industrial conflicts, just in numbers, right? So where is our power? Our power lies in the fact that tens of millions of Americans are suffering from the pandemic. They're suffering from lack of health care. They're suffering from lack of employment. They don't know right now that one of the reasons that they don't have testing and PPE and vaccines is because the government's spending their money buying missile defense, right? So we have to reach out to those people and make that connection clear. That's why we've called this campaign Fund Healthcare, Not Warfare, because we want to talk to those people who are looking for healthcare. And we want to unite with them and say, yes, we need better healthcare and more public health and more vaccines in the country. But if you want to get them, you're going to have to cut the Pentagon budget. So there's, lots of groups in Massachusetts who are for healthcare, but our coalition says, hey, if you want to join our coalition, you got to be also oppose weapons, nuclear weapons, vaccines, not submarines. I won't say we've gotten that far, but this opens up the possibility of going to the Mass Nurses Association, going to the Mass Public Health Association, going to SEIU, service employees who represent personal care attendants, and say, you want to take care of your people and their needs, you got to add this to add this plank to your platform. We're not that far along, but I hope in the next 6 months this will move forward. Now, there are a number of budget proposals. The Poor People's Moral Budget cuts the Pentagon budget. The Biden-Harris stimulus proposal is very good on one hand, $160 billion for public health and vaccines and hiring new health people, but it is silent on the Pentagon budget, right? We'll have to wait. So the Congressional Progressive Caucus, they have strengthened their number 6 plank now in their platform for America is explicitly end the endless wars, cut the Pentagon budget, get rid of the war, the AUF. It's stronger than it was in recent years. So as we've heard, Ro Khanna and other leaders, Barbara Lee, there is a group there in Congress, but they're going to need a lot of help from their constituents. And it falls to us to educate those constituents appropriately. So at that, I want to thank you for listening and being aboard. And we'll be looking forward to working together in the years to come. I want to remind you, because Senator Markey, who will be speaking later, Senator Markey's SANE bill, that does cut $75 billion from the nuclear weapons budget. And so that will certainly be one important campaign that we hope goes forward. So in summary, we're not, we're not in danger of being invaded by the Russians. We're not invaded invaded by the Chinese or Venezuelans or Iranians. And they don't have long range missiles. We're in danger of having the fabric of our society undermined by our failure to invest in and protect our national health and welfare. The most urgent risk facing Americans, whether viral pandemics, the climate change crisis, extreme inequality, income inequality, they do not have military solutions. Everybody on this call knows that. And we must shift our budgetary resources accordingly. Budgets are often done in hiding. In the state legislature, they used to be done in the middle of the night with no votes. You couldn't even find a record of it until it turned to come up in the newspaper. But we hope in the next year, not only in the US Congress, but in state legislatures, we'll be focusing on these budgetary choices and maybe shifting the needle a little bit. Thanks a lot.
Thank you. Thank you, Jonathan. Budgets are moral documents. I see a very good question by Richard Krushnick on the chat. And Richard, if you'd like to speak that question to Jonathan, that would be great, because you're linking the issues of the Green New Deal to our ability to exert more political pressure. I don't hear from Richard. So this question is to you, Jonathan.
Okay.
Regarding converting from military to civilian production, Richard notes that Congress members are concerned about all of the workers who are involved in the many jobs that are supporting the military industrial complex. And that unless we get a conversion to the Green New Deal jobs, they are, Richard makes the point, it's not the lobbyists so much as it is all these voters that Congress people are thinking about.
Okay, well, if you're down in Connecticut, in New London, Connecticut, where the submarines are built, it's really true. Those are good jobs. We had a campaign called Subways, Not Submarines. And our position was nuclear submarines don't get you to work, right? They don't close you, they don't help you, they don't educate your kids. We could be building subway trains in New London rather than importing them across the Pacific Ocean from China, right? And that would employ, right? That would it would employ more people are now employed. However, in fact, despite this point about the jobs, nuclear weapons production produces very few jobs, and they're very concentrated. New Mexico, state of Washington, South Carolina, very few people are employed in the production of nuclear weapons in Massachusetts. And campaigns like No First Use, which I think we're going to run with, don't threaten anybody's jobs immediately. The other thing is, yes, there are a lot of people employed making nuclear weapons. There are a hell of a lot of people who are unemployed. And if we had a Green New Deal, they would be employed building highways and repairing the bridges and building ferries that would get us to work. So historically, conversion campaigns, I participated in them 50 years ago. You met with the workers and you tried to convince them that rather than having a good job making missiles, better they had a good job building ferry boats. I never found a single person who was willing to give up their good job for some other job. much better to go to those people who are unemployed, right? Let's say the construction workers, and say, hey, we got this housing shortage in the country. Maybe let's have a national housing program and take some of the money from the submarines. So my view is that the form of the conversion program is not to try to convince the ones getting the money who are bought off the bribe sector, but go to the much, much larger group that's hurting because of the diversion of that money, which doesn't raise the standard of living, and put them to work doing things that solve social problems. And we hope to do a little bit with the Fund Healthcare, Not Warfare campaign in that direction.
Great, thank you. Richard, sorry, I didn't realize people were muted, so you couldn't speak. I hope I conveyed your question adequately to Jonathan. Jonathan, here's a question from Bill Hartung. Has the American Public Health Association done a budget that would produce a strong public health system?
So interesting that you should mention the American Public Health Association, because that's in our local campaign, that's one of our targets. So we've been working with members of the Massachusetts Public Health Association, all of whom, of course, are a member of the American Public Health Association. American Public Health Association has very good positions about more money needed for public health. And they have good positions on we shouldn't be invading Venezuela, but they don't have them coupled, right? They're in separate silos. And so we just yesterday on our, Thursday on our bi-weekly call, we thought, all right, when is the next meeting, next national meeting of the American Public Health Association? Let's see if we can organize a session that makes the coupling, fund healthcare, not warfare. So Bill, if you get an invitation to participate in an American Public Health Association meeting, please say yes. Now, we don't think just influence from the Mass Public Health Association can do it. We think we need some folks in other states to go to their public health. Every state in the union has a public health association. A couple of folks to go to their state public health association. It's an easy lift, and ask, and talk to them about, doing such a workshop in the state meeting or supporting such a position in the national APHA. So that'll be actually an organized part of the campaign. Public health is a different world than doctors, right? We have made much more progress with public health workers than we have with physicians who are whose income comes from the dedicated Medicare, Medicaid funds, and is not in the discretionary budget.